I guess that, as I said before, partnership. You have to partner with those that are going to use the study, keeping independence. I think that's the tricky part. The agenda has to be set commonly, but you have to make sure that whatever the results are, they are based on good science and they're also independent. So that's a balancing act, because it could be that the results do not please those that make decisions. A second thing I would find it's very important is it's not a one-by-one relationship. You have to involve other players, and we found that advocacy groups, interest groups, and the media are key players, especially if you're dealing with something that's controversial, because then it's through them that you can influence policy. The example was family planning. We had a very conservative group of health ministers that banned family planning for adolescents, for example. And through research, we showed that AIDS was increasing. The average age of AIDS patients had dropped 5 years in the last 8 to 10 years. It was about 17 and 18. And then it wasn't a matter of information. Adolescents knew what condoms and pills were. They just had no access to them. When we went with those results to the ministry, he said, that's rubbish. I'm not going to use that. We had to go through civil society organizations, women's groups and youth groups, and demanding that. The end result was the minister was sacked. That's a good example.
Okay. Finally, what 3 things could policymakers do to increase their use of research-based evidence?
First of all, I think policymakers need to understand research. And I feel that in many training activities, many of them are funded by the large development banks, the issue of using research for decision-making is not in the curriculum. I think it should be. I think we need to train researchers not only to understand research, but to know how to request it. I'm not saying that every policymaker needs to be an economist or know econometrics or neuroanthropology. What they have to know is that they have to ask the right questions, hire out the research, respect independence, and then use results for the results, for whatever policy. So I think that we've looked too much on the supply side and not enough on the demand side. The other thing I'd say, I'll stop here, is that we've looked at policy design. We have to look at policy implementation, because the devil is in the details. I think that unless we have good science on why do programs work and don't work, then we're way off what policymakers need. And at least in Latin America, there's a lot of research on how a policy is designed, but not a lot in terms of how policy is implemented.